Morgan and Christine Neely, training center coordinator for CPR training school for the American Heart Association, with some advice on what you need to know in order to save somebody's life. We're going to start with the lesson. So, Christine, what do we do first? As soon as somebody drops, what do we do?
Well, the first thing we want to do is pick up the phone and call 911, whether it's instructing somebody, you go call 911, or if I'm going to put it on speaker on my cell phone to call 911. Most important thing. Then I want to initiate high-quality chest compressions, pushing hard, pushing fast, at a rate of 100 to 120 compressions in a minute.
And is it true, right here, because I've always heard, and to help everyday folks understand this,
yes,
you should do those compressions while singing the song Staying Alive by the Bee Gees in your head, because that keeps the necessary beat to do this well.
That is correct. Staying Alive is 104 beats per minute, and we're compressing at a rate of 100 to 120 compressions in a minute. We want high-quality CPR. Y'all want to give it a try?
All right.
Okay.
And again, to stress, this is anybody can do this, right?
Anyone can do this. Okay. All you have to do is push hard and fast on the chest. You don't have to be trained. Okay, so we're going to put our hands in the center of the chest, on the lower half of the breastbone. So come a little bit lower. We're going to lock our arms. We're going to use our body weight. And we actually have some feedback here. So our goal is to have high-quality chest compressions. If we push hard enough, we're going to get one green light. Did you get it? Zero. And if you push fast enough, hard enough,
come on, Jay, put some muscle into it.
I mean, you really got to like.
Okay, you got some red, Rob.
Okay, we want to have. There you go. Rob's got it.
Okay, so we're getting some green lights here. Now, when we're talking about how hard you have to do it, Dr. Morgan.
Yes.
Should we be a little bit afraid?
It's really firm.
I know. I mean, how hard should we do it, and do we need to be nervous about, hurting any ribs or anything like that?
So you absolutely should not be nervous. Okay. And the point that we want to make is that anybody can do it, but it does require more effort probably than people think.
Right.
And I think Christine makes a great point, is that you can use your body weight and place your shoulders over your hands and use your body weight to actually cause those depressions, because many of us may not have the upper body strength. So make sure your shoulders are over your arms, the same as you would do a push-up with your shoulders over your wrist. And then your body weight is actually doing those compressions.
Right.
The other important thing is to make sure there's recoil. Come up such that you can make sure that the heart fills and contracts.
That's right there. So let's talk about the timeline, because when we're talking about Damar Hamlin's situation, we don't know the exact number of times he was resuscitated. We know it was at least one time, right? But you tweeted something, and if you aren't following her on Twitter, I mean, from COVID to basically anything, she has so much information and great information. But you tweeted something that really stuck out to me when it comes to the minutes and the seconds that really matter after something like this happens. So can you walk our viewers through just how important it is and how every second truly does matter when it comes to something like this?
All right, when we're talking about cardiac and the brain, every single minute matters. And so for defibrillation, for every minute that there is a delay, there's a 20% decrease in your chance for full long-term recovery. So if you can get that defibrillation to occur within the first minute of cardiac arrest, you have almost a 100% chance of full recovery.
Wow.
If it's 2 minutes, it approaches 80%, still pretty good, but it starts to decrease from there.
And, I don't think that the average person knows just how drastic that change is in percentage. I mean, 1 minute to 2 minutes. I mean, and then seeing how quickly those emergency responders reacted to that response, to that situation, very, very scary. A little heavy breathing back here.
That's right. Because your body and your brain are being deprived of oxygen.
Oh, man. That's scary.
And that's the thing, too, because let's face it, it was an NFL field. So they had all these incredibly well-trained medical personnel right there to rush in. Not everyone has that if this happens at the ShopRite or the Applebee's. Let's be honest. So time is of the essence. When we're doing this, though, should the person be in any kind of particular position in terms of how flat a surface, or in terms of just to make sure they're in the best position for the CPR to be effective?
We want them on a hard, flat surface down on the ground.
Okay, completely flat.
Completely flat.
And should we do it, perform CPR until 911 to the first responders get there, or should we wait for some kind of sign that the person's coming back to life? How long should you do? What's the sign?
Well, we want to continue high-quality chest compressions until more advanced training takes over, or if an AED arrives on the scene.
Talk about the importance of defibrillators, because that's another thing that's come out of this. They are so critical. You see them everywhere, thank God, these days. But explain what they do and why they're critical.
Okay, so AEDs are amazing. Anyone can operate an AED. All you have to do is turn it on. Right?
It talks to you.
It talks to you. It tells you everything. You don't have to be trained. AEDs save lives. My uncle's still alive today. An AED saved his life in November of 2001.
Wow.
Yes.
Wow.
So
And are these
it's
all models that talk to you? I mean, it's 2023 now, I know, but I mean, if it's an older version or a model of that, are we still going to have the same technology?
Absolutely.
Yeah, okay.
So anyone can operate an AED. All you have to do is turn it on. So let's try it here. I've got an AED trainer. You ready? So how do you think I turn that on?
I'm going to go with green means go.
Green means go. And it's going to literally talk to me.
If the patient is a child, press the child button.
Wow.
Remove clothing from the patient's chest. Remove packet and apply
So I'm
pads
going to
onto
apply the pads,
firmly on skin.
make sure I have good contact.
And where should you
talk
put
about the
those pads?
placement,
On skin.
There's pictures to show me where to put them.
Do not touch the
Okay, everybody clear back.
heart rhythm.
We want to clear everybody back.
Do
So,
not touch the patient.
so the AED can get a good reading to see if it's a shockable rhythm. Everybody stay clear. Stay clear.
Clear.
Stay clear.
Press the
You want to push the shock button?
Let's do it.
Okay, there you go. And then
Deliver.
we want to immediately go back to high quality chest compressions. Again,
Oh, that's an important point. It's not one or the other. It's a combo deal here. You should do the defib and continue CPR even once the defib has been activated.
correct.
Got it.
Wow.
And every 2 minutes, so I would continue CPR, every 2 minutes, the AED is going to come back and reanalyze to see if additional shocks may be needed. They may or may not, but we leave everything here, and when EMS arrives, they'll take right over.
And these aren't dangerous to touch or anything like that. You just go after it and be firm again, right?
Correct.
Wow.
And there is no way to accidentally deliver a shock. A lot of people are afraid, oh, I don't want to do it because what if I
You see it in
accidentally
the
shock
movies.
them?
In the movies
Right?
that
You hit the
happens.
button. You didn't shock, you hit the button.
There is no way it's dummy proof because the AED is analyzing if the shock is needed.
And the ongoing CPR is important.
Yeah.
So even without a defibrillator, that CPR is life-saving. And so we have to continue to do that CPR. And we know, again, with CPR, that every 1 minute that goes by also decreases the patient's or the person's risk of survival. And so we want to understand what it means for someone to actually collapse in the field. That bystander opportunity that you have to really save someone's life. Anybody can do it. It's very easy. This should not be something that's intimidating. We want everybody to stand up and be able to do this and to feel comfortable with it. And remember to call 911 first and then begin those chest compressions.
Yeah, and kind of along those lines, I mean, the American Heart Association says that 100 to 200,000 lives could be saved each year if CPR is performed early enough.
Yes, think about that. So we have about 350,000 attempts really at CPR and another 750,000 in the hospital. And so if we're able to increase the percentage of those amount of people who are surviving, when we know bystander CPR often only approaches 7 to 10% success rate, and in the hospital 20 to 30%. But if we look at those numbers, that's almost 200,000 lives that are saved. The other thing to remember about bystander CPR is that oftentimes there's not one particular reason a person will collapse. And so there are a multitude of medical reasons. So we want to make certain that that CPR continues until medical personnel can arrive and make the appropriate assessments.
Such a life-saving technique. Go ahead.
Real last quick question. Is there any part of this, because I see the plastic over the mouth for the dummies here, where mouth-to-mouth comes into play, or is what we've done between the CPR and the defib, is that enough?
Well, for the layperson that maybe's never been in a class, Those 3 steps: call 911, push hard and fast on the chest, use an AED as soon as it arrives. But if you have an opportunity to take CPR training, then you will learn the whole sequencing. And in CPR, we still have compressions, airway, breathing.
Real quick, how do you do that? Take that class.
So you can sign up. You can reference heart.org.